Couche, and good evening, everyone. This is John Lasher from Partners in Health, Sierra Leone. Today is Monday, June 15th. There were 7 new cases confirmed in the last 24 hours, bringing the total number of cases up to 1,176. Of those 1,176, 37 cases are centered around Kono District right now. And to give us updates from Kono, our Director of Operations, Ahmidu Barrie, is going to walk us through some of the steps PIH has taken to prepare the district for these additional cases and some of the work that's ongoing both at Koidu Government Hospital and at the Community Care Center that recently opened for asymptomatic and mildly symptomatic COVID-19 patients. Hi, Ahmidu.
Hi, John. How are you?
I'm doing well. How are you?
I am doing fine.
The last I saw, there were 37 confirmed cases in Kono. So can you just update us about the first cases in Kono and what you've been working on?
Yes. So our first index case is a nurse assigned to the emergency unit at Koidu Government Hospital. So after that, most of the nurses and CHOs that were working at the emergency units were quarantined, and in that quarantine, we were able to have many of the nurses and CHOs positive. And also, the index case for Wellbody also is a lab technician, and tested positive, and is in the CCC currently.
What's the CCC?
So the other cases also, the other initial cases that we had were cases that came in from Ivory Coast through the borders of Guinea and Combayende. So they were quarantined in Combayende, and out of those cases, the husband, the wife, and one of their child were positive. So those were like the first cases that we have in Kono.
The first case was at Koidu Government Hospital from the emergency department. So what happened at KGH?
So after the index case, the emergency unit was closed, and all the nurses and CHOs in that department were isolated in one hotel, the Dambe Leisure Lodge, and others were also isolated or quarantined in Sale district in one of PIH's guest houses. So we asked all our experts in that guest house to move out, and all the other workers of KG, the other clinicians at KGH were also isolated in that house. So that's the first response that we did, and also the DOC provided a quarantine center at the average guest house, which we had around 34 people quarantined. So that's the first quarantine home that was funded by the DOC. So the one at Dambe Leisure Lodge was provided by the DOC, but us, PIH, we are providing 3 meals a day for all the health workers that are quarantined in the guest house and also at the Sale District Guest House.
Okay, and so the DEOC, that's the District Emergency Operations Center, right? And what actually what's happening at the DEOC, and what's PIH's role there?
So the DEOC is a coordinating body in the district, and they report directly to the EOC in Freetown. So the DOC have representatives from all partners in the district, and they have all the pillars, the different pillars in the emergency response, like the surveillance, the nutrition pillar, the lab pillar, all those are represented together with partner organizations. So PIH is represented there. We are going to the DOC meetings every day, 5 to 6, and also we have the emergency response center, which we have the tally center where you have the information with regards the COVID response in the district.
after these first cases, a community care center was set up, right? Can you talk about the community care center?
Yes. So before the emergence of the DOC, so PIH, based on our experience during Ebola, we thought it wise that we need a community care center to have patients that are like asymptomatic or patients with mild cases. So we pushed that through the leadership of the districts, and until after everybody was saying when they established the DOC and have the coordinator, then it will be like their first responsibility to secure a space for the CCC. So when Sam was appointed as the district coordinator of the response, so our first assignment was to approach him and see if we can secure a space in Kono for the community care center. And he responded swiftly, and a space was provided at the Government Technical Institute, a 2 building. So PIH, we did renovation in that building to house a male, female ward, pediatric ward, and a recovery ward. So we did the construction, we installed lights and running water, and did a perimeter fencing. So at least the patient will not have like access outside, and the outside people will not have access to the community care center. So the CCC was completed. The day that we finished the completion, and that first day we had 5 patients that came into the community care center, because the treatment center at Kwedu Government Hospital was already full, so they have to send patients to the community care center. So as currently we have around 19 patients admitted at the community care center. Initially, like we had 15 beds, so we have to rally around to have more beds, at least to house patients. And currently, the first space that we created is already full, and we are planning like to do an extension, because it's like a two building school, and we want to also use the second wing to host positive cases that are asymptomatic or mild cases.
What's going to happen now that cases are increasing in Kono? Are beds still full, or like what are you going to do to increase bed capacity?
So our approach would be, as I said earlier, one, to increase the infrastructure at the CCC, because if we increase the capacity at the CCC, one, we will not be stretched in terms of human resource, and also because we are providing 24-hour electricity and running water, and currently it is being connected to well-body clinics. So we want to explore that facility first, and after it's full, then our second approach would be to negotiate for hotels, which are already, the infrastructure is already there. We'll use those rooms because most of the hotel rooms are self-contained, and the patients will have their bathroom inside, and they will not come outside. So that would be like our second approach after the CCC is full.
And is the
at the community care center. So I would say the social mobilization is going out, but the acceptance is really challenging. People don't want to accept that corona is there and it's real, because some of the positive cases that you see, they are healthy and that they are strong. So when you tell them that they are positive, it's hard for them like to accept. But we are getting there.
Mm-hmm. What's the feeling like right now in Kono with more cases?
So panic is there. People are panic, and but one thing that I'm happy about is the health system is stable, because even as of today, people are still going to the red body clinic. They are still going to KGH, although the number has reduced drastically, but people are still showing up in the health facilities. But in terms of the response in general, I think with the people in Kono seeing the cases going up every day, it's raising some panic around the town, and the acceptance is not there. Some people are saying like it's a way of making money, or the same scenario that was happening in Ebola. So,
Is there anything else happening in Kono that you wanted to update people on?
Yeah, with regards to the COVID, I think the DOC is working towards like having more partners on board, and making having like the powerman chiefs. They've also like rejuvenated like their bylaws, and with regards face masks and other stuff. So I think the social mobilization or the communication from the powerman chiefs is really great, and they are like really on top of situation, and they are communicating to their people in terms of acceptance.
Ahmidu, thank you for everything you're doing.
Thank you, John, and thank you, everyone.
Okay. Talk to you soon.
All right.
Bye. Thank you to Ahmidu and the rest of the team in Kono who are treating patients and preventing the spread of COVID-19. And thanks to all of you for listening. Hope you're having a great start to your week, and we'll be back with more updates very soon. Thanks.